Happy to be asked to speak here, but I made one request that we have a stage, because it's the only time I get to feel a little bit taller. Ideally, we're here to speak about healthcare industrialization. When we think about industrialization to begin with, many times we veer towards the car industry and we start to think about overworked, underpaid employees, or if you're a Family Guy fan like me, you may think of a Peter Griffin at work, and usually that doesn't end up too positive as well. But what we need to think about is the innovation, technology, and the future in medicine. We need to think about the customer and the relationships that we build, the satisfaction that we provide. Because at the end of the day, our customers are our patients. And so I believe 2016 is a beautiful year. I think it's an amazing time to be living, breathing. I think that change and evolution is among us. We're finally starting to see that science, passion, empathy, and innovation are coming together to form this beautiful product. And we're also starting to see the qualities that were lost in the healthcare industry, like concierge medicine. And an example of little Jeffrey here, 53 years ago, having his doctor come to his home and treat him. And now Dr. Jeffrey is going to his patient's home and treating them. And with change in any industry, we start to see risk, right? We start to see displacement. But if done correctly, we'll see great benefit. But in order for us to figure out where we're going in the healthcare industry, we need to start where we're at today. And depending on who you ask, you might get a glass half empty. With me, you get a glass half full. And sorry, I'm going to give you some bad news here. So we spend 17.5% of our GDP on healthcare. We're, according to the World Health Organization, we're ranked 37th in the world and spending 100% more than any other country. And the fact is that we have things like this discontinuity of care, where you go to a hospital, you go for an injury or a sickness, and you get treated and sign the dotted line, because of course you've got to make sure you get billed. Then you go away, and nobody ever follows up. And what happens a lot of times is that because of no national database, we're able to follow and track these patients, you get readmissions. That readmission may not be at the same hospital. It may be at another hospital. And they don't know what labs you've taken. They don't know what medications you've taken. And they expect the patient to just be this source of information. And so what happens is we also have this lack of time with physicians as well. So we have this newly insured patient population, growing healthcare industry. Physicians are under a lot of strain, constrained with time, and we expect highest quality of efforts and outcomes. But how do you, if most physicians, or I would say 81%, complain or report being overextended, and it's happening. So we don't have people stepping up. We don't have other healthcare professionals incorporating and things working in synergy. And we also have this little thing called prior authorization. I heard somebody laugh, right? Prior authorization, just to explain, if somebody doesn't know, it's like you have an orthopedic hand surgeon in the industry for 30 years, and he does a routine surgery weekly, same type of patient demographic. But yet every time he does this, he needs to go and call the insurance company, say, hey, is it okay if I run this again? Is that okay? And they have to tell him yes or no, usually no. Thank you guys. You'll get your money later. But see, the problem is this is like if we were to go to our gas station or our grocery store, and let's say we go to a gas station, we go to pump our gas, but before we pump that gas every week, we have to call our bank and say, hey, is it okay if I spend my money? We would never use a card again, right? So we're not really helping the system by having these barriers, but we're also not going to help the system by accepting all either. But the problem with this is that we're playing this game of tug of war, but except in this game, there's no rope in the middle. It usually ends up being the patient. And ideally, it's just another day in paradise, right? You just have to accept it. Don't worry, I have solutions. You guys looked a little depressed there, like, oh God, comes more problems. So with the discontinuity of care problem, we're now turning hospitalists into extensivists, where we have individuals that are, their role is to follow these patients for 90 days to ensure best practice available is associated, to ensure that lower readmissions are associated, and that there's a continuity of care. That people are now recognizing that somebody, I hate to say it like this, gives a crap, right, about your health. And that's important because patients want to feel that. Patients want to know that you care, right? We've all been patients at one time. We want to know that our doctor is listening to us, our pharmacist is listening to us. And with the whole national database, we're starting to see acquisitions and mergers associating, and you're starting to see these large healthcare organizations buy small community hospitals and communicating and improving the data that they're associated with. So when a patient goes, they have better access and communication, and doctors are speaking to each other. Healthcare becomes smoother. Patients become happier. And again, quality improves. With this lack of time concept, how do we deal with it? How do we deal with physicians being overextended? Right? Well, we have technology helping us out now. And we also have integral partners of the healthcare system coming together now, taking roles, role shifting, and finally stepping up to the plate so we can win and rally together as a team, right? So for example, you got telemedicine and EICU. And it's helping us out because we now have physicians at 2 a.m. in the morning, they can see a patient, monitor that patient, and prevent things like sepsis, and maintain and sustain that patient's health, and order medications before the on-call physician can actually even show up. And that lowers healthcare costs, because we know healthcare spending on sepsis is one of the largest when you're tough on treatment. And when we talk about partners, who's that good looking guy? sorry, a little biased, okay. Talk about physician's assistants, nurses, pharmacists, right? And again, I'll use myself as an example. Don't worry, guys. Clinical trial here. Pharmacists can now run pharmacogenetic testing, right? We can run pharmacogenetic testing, and we can see the risk factors associated with certain medication. We'll take Plavix, for instance, right? So many people are on Plavix. So Plavix, you have a 24% risk factor with bleeding associated with Caucasians, 33% with African American, and 50% with the Asian population. These are risks of bleeding. If we can monitor this, see this ahead of time, and prevent bleeding risk, guess what that means? Less hospitalizations, decreased costs. Simple things. Oral swab, non-invasive, right? How crazy is that? That's all we got to do. Or micronutrient testing. We know drugs deplete certain vitamins and minerals, so why are we not looking at this? Why are we treating the symptoms and not the causes, right? Why are we not looking deeper into these patients? It's very simple. Little blood. I mean, we do that for CBC, CMP. We look at liver function, kidney function. But we're not looking at vitamins. But we can now. We can step up to the plate. And when we talk about this prior authorization problem, now we're starting to see healthcare organizations hire former insurance representatives. So there's better communication between the insurance companies. It's not just a physician or his staff saying, we need this done. No, it's now communication saying, hey, here are the loopholes. Here's how you get through and communicate with these individuals so there's higher approval ratings for your commonly and routine processes, your routine procedures. So stress goes down, and that AMA spends, they say that physician society spends $12 billion a year on administrative costs associated with these things. We can less than that. And we can start spending money into increasing the technology that we have inside the offices. And now we're having joining of hands of drug companies, drug manufacturers, and research agencies like the NIH, which happens to be here today, and also insurers coming together, increasing the standard, sharing data, and understanding that in order for everybody on the business side, right, to make money, you can't spend too much because that doesn't make sense. You can't overspend and not profit. That doesn't make any sense. But also, the way to profit in this industry is by best quality practice. We're starting to see that. We're understanding that now. We're seeing things It's going to be like personalized medicine come out of this. And the reason is because with that data that we're now sharing and opening our operations to, we can now treat specific groups of patients. We're seeing things introduced like the paper performance model. And paper performance model is one that I love because we learn so much about fourth stage clinical trials. And we're finally starting to see that with the drugs. And we're starting to see that with our patients now. And people are starting to recognize. And why? Paper performance. Well, we can now ensure that a drug hits those target test goals, right? And now we start to see that data associated. I think every drug we should be able to do that. We should even go a little bit further and hold patients accountable to ensure that they follow up with those tests. Because that's a patient-centered model to me. And now technology and the advancements and how we're moving forward and how it's helping us move forward actually and making it so we can communicate with our patients. We have apps that can monitor diabetes and glucose and do this through a Bluetooth device and be able to send that trend to your doctor within 2 minutes. Instead of you having to go to your doctor and spend 2 hours waiting and all these complaints, right? It sounds fatiguing. Why would we want to follow up, right? We can do this ourselves, we can do a little finger stick and hope that we keep accountable and later you get it, right? And we have apps that allow us to monitor other chronic diseases and disorders like COPD and asthma. You can see if the patient has accountability or if the device needs to be replaced. Sometimes I see some of my patients sitting there, what are you doing? And I find out that it's clogged. And simple things by just unclogging it can help, right? But some patients don't understand that. They think they're getting the medication. They don't know why, that they keep breathing and wheezing hard at night. So it's us stepping in and utilizing these things to monitor that. And the best thing is that we're seeing, like Dan had spoke about the Uber aspect. We're starting to see apps that, just like Uber, you can push a button and right away you're connected to a mental health counselor. We know 1 out of 5 Americans will experience a mental health issue every year. That's a problem. And we're starting to recognize it. And businesses are starting to recognize it. And they're starting to accept it in the workplace and build a culture around it so we can start managing things like depression. So these are very important concepts with, like I said, mental health, because again, you see people like the VA. In 2014, they did 325,000 telemedicine conferences with patients and reduced their inpatient psychiatric admissions by 24%. So everybody understands that's obviously improving our system. And then you see things like Google Glass be used and the surgeon will use, right? And now physicians no longer have to go and look at monitors for vitals or ask for those, and now they can just focus on the procedure in front of them. We're seeing things like Apple introduce the research kit, where now we're putting data researchers and analysis with other scientists and doctors together to build this platform of information where we can start to follow patients and find patients in special interest groups and be able to recruit them and educate them to get real live data. That's the most important thing, real live data. No more retrospective aspects. Let's start looking at real live data now. And things like 3D printing, where we can take your disabled veteran, or other disabled patients that are in need of prosthetics, and we can properly fit them and make them happy, and make them feel good about that piece. If you think about it, not having a leg, not having an arm, and now you have a prosthetic that doesn't fit, well, the world really loves you, right? But now we can help this problem, and we have a solution. And it can be printed right on the spot instead of waiting 2 weeks for it to come back. That's the important, right now. People want things right now. And in the future, we're going to start to see things like 3D printing, where we can print organs and test drugs on them and run studies on them instead of mice and rabbits and hoping that this study correlates to a human being. Where we will have artificial tattoos with microchips in them, where we can monitor heart rhythm and heart rate, and as well as your oxygen saturation while you sleep. We'll see things like nanotechnology in the shape of a pill, where it has a little camera on it, and take that pill, and I'm going to do endoscopies and colonoscopies without being invasive, which helps us also lower those healthcare costs. We'll see the return of needleless sharps. reduce phobias, and also reduce the costs associated with needle stick injuries. CDC reports that it costs up to $5,000 to treat needle stick injuries. We won't even get into the litigation if someone does pursue that. That's another wind of healthcare costs associated. And now we're starting to see new technology, or we will see new technology, in the manufacturing process. Right now we have a manufacturing process, I don't know if anybody's familiar with it, but it's not that great. We have about, the time that we start to produce the drugs, it takes about 100 to 300 days to get that drug to the shelf. That doesn't make sense. We wonder why there's drug shortages. We wonder why there's high costs associated with drugs. With new technology, we'll be able to reach 10 days and lower those costs, lower those drug shortages, so our patients can have the right medications for their chronic treatment. We'll live in a world where no longer you're rewarded with a lollipop for being a good patient, but rather where you're rewarded with great information about fitness, wellness, nutrition, how to be optimally healthy, where vitamins will be prescribed and covered, and we'll start to treat the causes rather than the symptoms. From a business perspective, we're looking at an industry that's worth $36.7 billion. Somebody's missing out on something, right? Because I jumped on the boat a long time ago, and I can tell you, people want this stuff. People want it. People want stuff that works. And eventually we'll have liaisons that will sit by your side, past a patient advocate that's just worried about getting that piece of paper to you and giving you a stack of information about your Coumadin and what food not to eat, so you just take that and throw it away. They'll become healthcare coaches, and they'll motivate you to make positive changes in your own past your stay at the hospital. And we'll see finally the kiosk, where you'll be able to go up to a kiosk, have a consultation with your physician or pharmacist, put your finger on a touchpad, they'll sample your blood, and just like that, your vitamins, your INR will be analyzed, and within 5 minutes, your personalized 30-day supply of Coumadin will be packaged and delivered for you to take up and go. But we know, with technology, we need to be on top of cybersecurity. We need to ensure that we constantly assess for vulnerabilities. Because just like any other business, it takes an investment to get your return. We're going to have to invest a lot into cybersecurity to continuously monitor these things to make sure that our patients and our practice is protected. And why does this all matter? Because in order to thrive with quality in this industry and be impervious to the unfavorable outcomes of fragmentation, we need to continuously work on our work ethic and be the absolute best at what we do. And now I leave you with a few of my favorite books and some words. We need to stop putting the duct tape over the check engine light and start treating the causes. We can't cover up and sweep these things under the carpet anymore. There's problems that exist, and we need to speak up and actually do something about it, not just be the guys that complain and say, well, our system is terrible. We need to come together and put our passion behind our work. We need to innovate and speak up, network, meet people that can make things happen, team with other individuals, and do things in this industry to improve the quality. Be so good. Thank you guys, I appreciate it.